So today we're going to start talking about the new MSSP rules in 2024. And specifically, we're going to talk about the savings add back. But before we dive into the details, let's just go back out to the higher level view and talk about why Medicare is adding in these new rules. Why now? Well, it came out with this stated goal of getting 100% of Medicare fee-for-service beneficiaries into some sort of value-based agreement. Well, MSSP is the largest program of those types of agreements, and so they're adjusting these rules to encourage ACOs to stay in the program and also to try to encourage non-ACOs to join up and become ACOs. So that's the impetus behind these rules. Now, let's talk specifically about how the savings add back is an incentive. So it's really a good incentive for those that are to stay in the program. The reason is it helps reduce this ratchet effect. Now, in other videos, we've talked about this ratchet effect, and really, as a reminder, it's the situation that occurs when you have positive performance in one contract period actually makes future performance in other contract periods a little more difficult. That's because you start out with your initial benchmark, and this is what your prices cost before your ACO existed. And in that first agreement period, you have success. So you actually reduce the cost for your beneficiaries, you achieve savings. Well, then the next contract period, those benchmark years align with your performance years. So you've already reduced that spending a little bit. So your benchmark, what you're compared against, is lower than it would have been if you didn't exist. And that's going to keep happening. So you get tighter and tighter in your ability to achieve savings. Well, in order to address this, Medicare said, well, we'll take some of those savings that you realized and we'll add them back into your benchmark. So we'll inflate your benchmark a little bit so that what you're being compared against actually includes some of those savings that you achieved. Now, it doesn't include everything. It doesn't eliminate the ratchet, but it does reduce it to a degree. Now, this is also an incentive for ACOs to join, and because there's kind of this future look of hey, we know we can achieve some savings and we won't have as much of a ratchet effect. It also can be a benefit to regionally inefficient ACOs. Now, this isn't maybe the main goal of this, but if you're a regionally inefficient ACO, you're going to take a hit on your benchmark. And that hit is pretty small in earlier years, but it grows. But as a more inefficient regionally inefficient ACO, you should have a little more room to improve. And so hopefully you should achieve those savings, and therefore you'll be able to get this savings add back, which will help you to overcome some of that regional inefficiency and some of the penalties that are kind of built into the MSSP rules. Now, as we go through the flowchart, you'll see exactly how this all plays out. But those are two important incentives. Now, one of the most confusing things, and we'll get into this as we go through the flowchart, but one of the most confusing things about this rule is really that is done on a per beneficiary basis. And this creates just a little bit of confusing calculations at the beginning. And really all that's doing is stating your savings as a per beneficiary amount. And so here is the flowchart for the savings add back, and it's really kind of broken into two sections. We have the first section, which is calculating the prior savings, and then we have a second section, which is all about how to apply that prior savings. So we're going to dive into just the simple calculations. Now, this is pretty simple. First step is you're going to figure out your average savings or losses. And these are going to be the average savings or losses over the years that are now your current benchmark years. So you look at the overlap of your prior contract to this contract, and any of the savings in those three benchmark years are then averaged. Now, if your ACO didn't exist for one of those years, you decided to re-up early, or it wasn't reconciled for some reason, you still divide by 3. So you're averaging over 3 years no matter what. But you sum up only the years that are available, and you sum the savings and the losses together. Once you have that average, then you're going to say, is that above 0? Were there savings to add back? If yes, you move on. If no, the rest of this no longer applies to you. Then we're going to multiply that. So earlier in the video, I talked about this per beneficiary number and that there's a little bit of funky math in here. And that's really what this ratio of box is. All it's really saying is that we're going to take the savings that you had and adjust it to the amount of beneficiaries in your current ACO. So the way they do that is they take the ratio of the average number of beneficiaries in your benchmark years to the average number that were in the performance years. So we take your first contract period. If you had, let's just say you had 10,000 beneficiaries on average, and your ACO grows a whole bunch. So now you have 20,000 beneficiaries. Well, they're not going to allow you to apply the savings that you achieved on only 10,000 people to 20,000 people. So you don't get that extra bump. And that's where this proration factor comes in. So we take that 10,000 and we divide it by the 20,000. So you grew a whole bunch. So now we're going to take your savings and cut them in half, but we're going to apply it to twice the number of beneficiaries. So your total savings still gets included, but the per beneficiary amount is half. Now, what happens if the reverse happens? Your ACO actually shrinks. So let's say your ACO goes from 20,000 to 10,000. Well, this ratio is actually capped at 1. So again, if you've achieved a whole bunch of savings on the 20,000 and then you go down to 10,000, they again don't let you to have that extra savings. Even though you achieved it on all those 20,000, you can't apply that to the 10,000. So it's capped at 1. So even though that ratio would be 2, the max it is ever 1. So you would just then take your total savings and losses. You're multiplying by 1. So it's really just whatever your average savings or losses is. This is your prior savings adjustment. So now we move on to how this gets applied. And this is where things get a little more complicated. So we have 2 options, and this is related to the regional adjustment. So the first question is going to be, is your regional adjustment positive? If your regional adjustment is positive, we'll start up here at the top. So yes, you have a positive regional adjustment. Now, fairly simply, CMS is going to say, we're going to give you the larger of the 2. But first, they're going to apply a cap and a proration to your average savings. So you'll recognize this if you remember the regional adjustment video. This is the same cap and proration that they do for regional adjustment. So we're going to multiply our prior average savings by 50%. And then we're going to cap that at 5% of the national PMPY. If once you've applied this to your prior savings adjustment, if that's larger than your regional adjustment, then you would get the prior savings. If it's less than the regional adjustment, then you get the regional adjustment. You get the bigger of the 2. So now let's say that you have a negative regional adjustment. 2 things can happen with a negative regional adjustment. But the first step in either is that you sum the prior savings adjustment with your negative regional adjustment. If that sum is positive, then you would apply the same proration and cap as we saw up here. So you had a negative regional adjustment of $50 and you had prior savings add back of $100. So now you have 50. You'd multiply that $50 adjustment. You'd multiply that by 50%. So now you're at 25. That's not going to be capped, but if it were large enough, it'd be capped at 5% of the national PMPY. And that's your total adjustment. If, on the other hand, your regional adjustment was a negative $100 and your prior savings was 50, when you sum those together, you still are negative. And then there's no multiplying by 50 or capping. You just simply have a new adjustment that is now that negative 50. So that's the application of the prior savings add back. I hope this provided some clarity around this new rule and that you will join us for future videos.